7:20 here, Big 550 KTRS. Coming up in 1/2 hour, we're going to check in with Jessica Bach, who is covering the Kirkwood lockdown story for the St. Louis Post-Dispatch. She's got a great story in the newspaper today. You can get it from your front doorstep or at stltoday.com. She'll join us here with the latest in about a half hour. Earlier in the week, there was a story that came out that Mark Lamping, who's been on the show a number of times, introduced an interesting bill about health care. We've asked our next guest to come and talk about it, Missouri State Senator Scott Sifton. Scott, welcome back to Big 550 KTRS.
Good morning, McGraw. It's good to be back.
In terms of full disclosure, do you sit on the board of Nurses for Newborns?
I do not sit on the board of Nurses for Newborns, but I am a strong supporter and advocate. Sharon Rohrbach, the founder, is a neighbor of mine.
Yeah, and is that part of your district or no?
It is headquartered in Shrewsbury, which in the last redistricting just barely got carved out of my district, which I was very disappointed about. So
all right.
I don't have Shrewsbury, but it's very close by.
All right. Well, look, in terms of full disclosure, we have a rule here that if you are a supporter of Nurses for Newborns, you get special treatment. So you will get somewhat special treatment, but not the full treatment because you don't sit on the board.
I greatly appreciate that, and I'll obviously have to think about joining the board.
That's exactly right.
Get some kind of a door prize.
And if you even think about doing something against Nurses for Newborns down in Jefferson City, we'll sick all the nurses on you, and you know that's not right.
Well, no, I appreciate that. We've had that conversation before, and I am duly admonished.
Okay, just to let you know. All right, good.
I would never do that.
Okay, I just need to make sure. Okay, now let's get to it. So this bill, from what was reported in the news media, from what I understand, Republican Mark Lamping wants to pass a law that says that if insurance companies cooperate with the Affordable Care Act, they'll lose their license?
Yes. There is a provision in Senator Lamping's bill that is targeted at insurers who might provide policies for folks who are above the 138% Medicaid threshold but under 4 times the federal poverty level for a family of 4. And insurers could lose their license if they cooperate and provide coverage in that band that the health care exchange is meant to provide. Missouri has a voter-approved initiative against exchanges, and this bill is intended to modify that by saying you can lose your license if you actually provide health insurance.
Maybe this question is better directed at him, but does he hate the people of Missouri?
Senator Lamping and I have worked together on many issues. We happen to disagree very strongly on this one, but there have been plenty of issues that we've worked together on and agree on.
First of all, is there any chance of this bill ever passing?
You know, as a member of the minority, we're always a little coy about when we might intend to filibuster. That said, I'll put it this way. If this were to reach the floor, I would have an awful lot to say about it, I'm sure.
Because, and going forward with this Affordable Care Act, somebody said this to me, Scott Sifton, let me make sure I have my facts correct. If you make above, say, $3,000, whatever the minimum threshold is to be on Medicare in this state, or Medicaid, I guess, Medicaid is for the poor, up to 100% of the poverty, right? So between $3,000 and whatever the level of poverty is, you are not subsidized for your health care.
You would go into, well, depending on what level we made our Medicaid eligibility threshold be in Missouri, you're right. You would not have subsidies. You would be on Medicaid.
But if you're above the threshold for Medicaid, so there's a donut between like $3,000 or whatever that minimum threshold is. If you're a member of the working poor, your health care is not subsidized by anybody.
You have to be at 100, as it stands under the ACA, you have to be at 138% of the federal poverty level to qualify for subsidies in the exchange. Now, you would, assuming Missouri expanded Medicaid up to the 138%, you would be covered by Medicaid, which many would regard as a subsidy.
Right.
So the idea is that states would increase Medicaid coverage to 138% of poverty. From there, the exchanges would take over and cover up to 400% of poverty with subsidies that diminish the higher your income is.
Where do the elected officials think these people are going to get medical assistance from, and who's going to pay for it if we don't take this federal funds?
Well, the answer is very simple. It's what we've already been doing. These people will get medical assistance when they show up in an emergency room, whether they've had preventative care or not, at great expense to all of us who are paying health insurance premiums.
Sounds to me like it's not very economically feasible or smart to do this.
There's a reason the healthcare industry has become 1/6 of our economy, and it's not because it's been done as efficiently as it could be.
Medicaid expansion dead down in Jefferson City?
You know, we'll see. I am hopeful that that we can get something done on that this year. There are some determined opponents. That said, the Republican Party has made it very clear that they would like to see a change in our state's tax policy. The governor has objected to that to this point. What I would say is I would hope that if Democrats perhaps could show some flexibility on tax policy, it would be nice to see Republicans show some flexibility on Medicaid. So I'm hoping that we can reach some kind of grand bargain. Doesn't mean it'll happen. But that is the angle that I'm going to pursue this year.
That's interesting. So maybe there might be you give a little bit on cutting taxes, and we'll give a little on expanding, taking our own tax dollars back from the federal government.
Well, very, very simply, you're probably not going to get a tax cut without at least some cooperation from Democrats. You're certainly not going to get Medicaid expansion without some cooperation from Republicans, and I think people in our region want to see us go to Jefferson City and try to get things done together, so that's what I'm working to try to do.
The threat of these hospitals, rural hospitals, are saying we're going to shut down because we're not getting federal funds anymore for reimbursement for the indigent care. How real of a threat is that?
It's a very real threat, and it's actually not just rural hospitals. I won't name names. I mean, substantially every hospital in our region that gets disproportionate share payments from the federal government will take a hit. Some will take a sustainable hit. There are some hospitals here in St. Louis that will take a hit that they cannot afford while still operating. So I don't think closures will be limited to outstate areas.
I think people need to understand how it's funded, and this is kind of because there's so much misinformation out there, and please expand on this. Is it, from what I understand, we're going from a system in which you didn't have insurance, you showed up at the emergency room, and this is sort of a very simplistic example. You don't have insurance, you go to the emergency room, the feds reimburse in some way, shape, or form the hospital. The Fed said, because we're going to expand Medicare or Medicaid,
right,
this reimbursement's going to go away. So now we as a state are not going to expand Medicaid, and the feds are taking away the reimbursement to the hospitals. So these poor people are still going to the hospitals, not getting reimbursed by the feds, and not then in Medicaid. So it's a double whammy?
Taxpayers and people who pay health insurance premiums are the ones who will bear the burden, and to the extent hospitals don't get paid, they have to try to either figure out how to do business without getting paid for those patients, or some of them won't be able to do business.
Are there any other legislators down in Jefferson City that don't want federal funds for highways or buildings or anything else that we get money from the federal government for?
You know, there's 197 of us. I'm sure there's probably at least a handful to espouse just about any point of view you could possibly imagine. I'm sure there's some who believe all of that as well, yes.
Yes, but I mean, anybody making as big a stink as not wanting federal funds for health insurance?
You know, I will say the same senator who introduced this bill was also the senator who killed a bill to ask Missourians to weigh in on their state transportation and highway funding last year. So there are some who are determined to keep us from moving forward on those fronts.
Let me ask you this question: do you have friends on the other side of the aisle?
I do.
Yeah. Would they call you a friend publicly?
I would hope so. I don't want to put words in their mouths, but there are some of them that I would call friends. We all work very well together. We don't always agree, but it's not nearly as combative as I think sometimes the public is made to imagine.
So what we see on the outside isn't necessarily what we see on the inside?
Hopefully not. I mean,
Have you been threatened to be sued by Speaker of the House, Tim Jones?
Not that I'm aware of.
Oh, I have numerous times. Last question for you, State Senator Scott Sifton, who you will be joining us as a fill-in on the board meeting here at 9 o'clock.
Pinch hitting,
if you will, because John Deal, late scratch for John Deal. What are the odds? Because Kansas has lowered their taxes, and people are saying, oh, my goodness, a border state is lowering their taxes. Everyone's going to now move to Texas. We need to cut our taxes. How much of this argument would fly down in Jefferson City?
You know, I just sat in an hour-and-a-half long Ways and Means hearing yesterday morning where precisely that argument was laid out in connection with 3 different bills that were all heard that would all make pretty substantial tax cuts.
Right.
And, you know, I think the truth lies somewhere in between. Some would say we need to imitate Kansas. Others would say we can safely ignore it. I don't think either of those are true.
But here's my question. How can you go into those same meetings and say, well, wait a minute, Colorado legalized marijuana. All the young kids are going to run to Colorado. We better legalize marijuana.
You know, nobody made that point yesterday, McGraw, but not.
Right?
I will tell you, there actually are a couple in the Senate who would espouse that point of view. I happen not to be one of them.
But I mean, the argument is if one state's doing it, we better do it or else.
You know, we are in a competition. Missouri does have as many border states as any other state in the union, and that does make us somewhat more susceptible to having to watch what our neighbors do.
Right. And you're not insinuating Colorado is a border state because it's not.
It is not.
That is correct. I just want to make sure. Right. I wanted to make sure. I didn't want to put words in your mouth.
No, I appreciate that. Yeah. No, we have Kansas insulating us from our friends in Colorado.
Right. Our acquaintances in Colorado. I wouldn't necessarily call them friends. That's Scott Sifton. He's going to take a break for a little bit. Scott, thanks for coming in. Then we'll see you back at 9 o'clock.
Thank you, McGraw.
You got it. 7:32 here, Big 550 KT.